I always love the opportunity we have on this show to learn about things we may not know so much about, Sean. Today we're going to talk about neuropathy. Peripheral neuropathy is a condition of nerve damage, and that can be due to a whole bunch of different causes, some of which are, I don't know, diabetes, infections, metabolic problems. And actually, the guest about to join us was asked so many questions the last time he was back on the show. So he's back again today to answer even more than them.
No question. Dr. Joshua Purcell is here, the clinical director of Active Life Health and Wellness. He's also the author of Natural Neuropathy Solutions, and he's joining us now. How are you, sir?
I'm very good. Thank you. Glad to be back.
Let's talk about last time you were on the show, we got a whole bunch of calls regarding neuropathy, explaining what this is, because even I'm trying to figure it out myself. Peripheral neuropathy. What is this again for those of us that might have missed the first segment?
Sure, and that's a very common question that we get asked in the clinic here every day. So, peripheral neuropathy is a condition of nerve damage as well as blood flow problems, nitric oxide production. So what happens is the blood vessels start to constrict. When they constrict, the blood and nutrition can't get to the tissue, usually in the feet and the hands. So that starts to damage the nerves. And that's what peripheral neuropathy is. It's a condition of nerve and blood flow.
Yeah, wow. It sounds very serious. I know that you're helping people through this condition. Let's talk about some of the causes. And then also, if you could let us know, what are the symptoms? Because so many of us have a tendency to self-diagnose. We don't want to do that. We want to talk to an expert.
Sure. So there's a lot of different causes. In fact, there's over 100 different reasons why people can get neuropathy. Some of the biggest would be diabetic neuropathy, problems in the spine that interfere with the nerves. There's Agent Orange, there's metabolic, there's toxins, and there's just some unknowns. They call it idiopathic. Some of the concerns with neuropathy, the conditions and the symptoms of neuropathy would be numbness, tingling, burning, muscle weakness, or complete numbness where you just don't feel anything. I've got several patients that also experience balance and sleep. Those would be the two biggest concerns that most of the people with neuropathy have, is their balance and sleep.
Yeah. Now, what are treatments like? I'm assuming that depending on where it's being done, a lot of it's a lot of medication that's probably very expensive. How are you doing it over at Active Life?
Well, that's a great question. And we see a lot of really antiquated medical drug approach, where most people that have neuropathy are treating with drugs such as Lyrica, Cymbalta, gabapentin, Neurontin, and those are very dangerous side effects. And the reality is, if they worked, we wouldn't really have a natural approach and we wouldn't have a necessity. But we're extremely busy. And that first time we aired, we got a bunch of calls as well. And luckily, we were able to help people. So what they're going to do is they come into a class. We have a little educational seminar where we go over the natural approach. So we're focusing on how do we fix the cause of neuropathy versus the symptoms, where the drugs are designed to try to treat the symptoms, where we're focusing on the cause. If we can remove the cause, then the symptoms start to go away on their own. So it's a natural exam. It's a sensory test where we can figure out exactly how much loss somebody has. And then based on that number, we have specific natural protocols where we treat without drugs and without surgery.
It's so interesting. So many of the symptoms that you mentioned, doctor, I think are fairly common. I mean, to have sleep issues, to have numbness and tingling. Do most of your patients come to you because they've been referred or already diagnosed with neuropathy, or are you helping to diagnose people?
Well, that's a good question. We get a combination of both. We have some that have been through the entire medical gamut. They have their nerve velocity test. They've had every treatment possible, and they've been told there's really nothing they can do, and they're already on the gabapentin. Other people will see like this video, and they start wondering. They didn't know they've been diagnosed, but they have a lot of the symptoms that they hear about, so they'll come in to explore that option as well. So we see both.
So if people call your office right now, they can reserve a seat into your next seminar. And the first 15 callers are actually going to get a copy of your book, right?
Yeah, I wrote a book here, the Natural Neuropathy Solutions. And so the first 15 people will get a copy of this book. And then in the educational seminar, of course, there's no charge as well, where we give an introduction about what it is that we do. And then there'll be an option for them to move on into that sensory test if they're interested after that class. Absolutely.
Yeah. Dr. Purcell, thank you so much for your time and your explanations. Appreciate it.
Great. Yeah, thank you. It's great to be here again.
All right, take advantage of that special offer. Give their office a call. Make sure that you get in on that educational neuropathy seminar. And first 15 callers that do so are going to get a free copy of that book, Natural Neuropathy Solutions. Active Life Health and Wellness Las Vegas. You can find it at activelifehealthlasvegas.com. The phone number there as well. Active Life Health and Wellness Chiropractic, a proud sponsor of the Morning Play.